They go over for a longer period of time in the intention of not doing, but teaching the surgeons and the nurses.
We have the Mongolians first be an assistant for 3 to 5 laparoscopic cholecystectomy cases. And once they gain enough experience and we're comfortable, they understand the ability to look with the camera and to do the different parts of the procedure. They then switch and go to the other side of the table where they are the surgeon. And we have them do 5 cases as a surgeon. And then before we leave, we hopefully have them do 3 to 5 cases where they are an assistant and a surgeon, both with Mongolians, and not having the American be scrubbed at all, or at least being scrubbed just to hold the camera. And that way, within 2 weeks, they're able to really learn a new technique.
So we're teaching the teachers, which I think is very important.
So I've been involved in mainly helping to train the nurses alongside be able to effectively help the doctors. So basically what I would do is everything from teaching the nurses proper sterile technique to learning the new instruments and how to take care of them, how to clean them, how to sterilize them.
Without good sterilization, how we can do a good surgery? That's why we are teaching them all how to sterilize, how to clean up all these equipments and basic general surgery techniques.
It's a little bit difficult because of the language barrier, first of all.
We have a translator that is with our surgeon. We have a translator with a scrub nurse. I have a translator with the anesthesiologist and a translator with the biotechnician. That way everybody can be teaching their counterpart all at the same time without having to rely on one person. And it's been one of the important ways to be able to now transition to have them doing a lot of the teaching, so we don't have to rely so much on the translation. It wasn't until years later that Dr. Segerlin told us after we taught many courses. She said, "Dr. Price, one of the best things and most important things you've brought to Mongolia is a new way to teach surgery." And she said, "Well, in Mongolia, we usually teach surgery where people just watch. They don't really do a lot." She said, "Within a very short time, you give our surgeons experience so that by the time you leave, they have the skills necessary to be able to continue on." It's turned out that as we have worked in Mongolia, I have developed very close friendships with the doctors and nurses there. It's now more than just going to Mongolia, it's going back to see friends.
I think we were treated wonderfully.
Every time I've been to Mongolia, I've frozen. Doesn't matter how much warm stuff I wear. But we get into their gear, and they have their stove inside, and it's warm. They've shown us how they make their food. We've been able to be out in the countryside, and to make horhak, they put all those hot stones together in with the food.
Nothing like brotherly love when somebody slaughters you an animal.
And to eat every part of the goat and the sheep imaginable.
You don't? How about the liver or kidney?
Swing and a miss.
It's caused us to bind together as friends, so that when we're in the operating room, it's more than just doctor to doctor. It's a friend-to-friend relationship that we have built there that has made, I think, the program even more successful.
Not only have we taught laparoscopic surgery in Mongolia, but we've had a nursing program, the medical technician program.
I can open her airway like this and give her oxygen.
So we're totally behind teaching the teachers.
It's doctors, nurses, biomedical technicians, logistical support staff. It takes a lot of people in order to accomplish the missions that we have every time we go.
We have tried to also teach traditional practices in surgery, so we've also taught emergency surgery and trauma surgery. We don't want to walk away from that.
But we're able to develop a sterile technique course, able to develop an emergency trauma surgery course, so that everywhere we went to teach laparoscopy, we could also bring in doctors from around the countryside to take the basic and emergency surgery courses and the sterile technique courses. So in essence, trying to improve the whole basis of surgical care and medical care throughout Mongolia.
The benefits to Mongolia be a decrease in the recovery time, the reduction of introduction of infections.
Less trauma to the body to the point that they need fewer medications, they hopefully have fewer infections. Laparoscopy can really benefit them because they need such less post-operative care.
Because you're providing a much smaller incision, the overall health benefits are just much better for the patients.
She or he can walk after 5 days or 7 days.
If you do a major abdominal surgery, that requires so much more intensive care afterwards that, the folks in Mongolia just don't have the resources to sustain that.
Last week, we already done around 20 surgery, laparoscopy, no complication. All patients is very happy. Many patients waiting and asking us to do laparoscopic cholecystectomy.
Patients would be up smiling and walking down the hall the day of surgery and the day after surgery and felt good and were able to go home.
No pain at all.
No pain? That's great.
Does it cause problems with the hospital? Does it overload the system? Are there problems with bringing it in that we need to be aware of that we can make improvements?
Well, I think for our personal experience, we have no problem. We have not such problem.
Think of our hospital beds and think of the worst situation you can lie on. And that's what they sleep on. And so to shorten those stays and they can go home has been just unbelievable.
We'd have patients telling us, thank you for coming in and teaching our doctors how to do this surgery.
Almost everybody that we came in contact with was extremely grateful.
It made us not want to leave at the end.
They were so grateful.
This last trip was amazing, just the pure friendliness of the healthcare workers.
I've had doctors come up to me and tell me this has been the best thing they've ever done in their life.
One of the most touching moments was we had a going away dinner. Basically, they were just sung to us in thankfulness. It was more powerful than words could explain.
They have developed now their first manual in laparoscopic surgery. They are now developing their own laparoscopic courses when we're gone. We were recognized when the Minister of Health gave us an award. Gave us a medal for our work in Mongolia for improving surgical and medical care throughout the country.
Thank you for all people who's trying to help Mongolia.
Looking at our time in Mongolia and looking at the conditions in Mongolia when we began and where they are now, makes me think that there's a really bright future for the hospitals in Mongolia. The doctors are better trained. So I think that the hospitals in Mongolia are going to continue to improve, not only over the next 5 years, but far into the future.